And tonight we continue our Let's Talk coverage with a story about a very familiar struggle for so many people. Imagine being so paralyzed by worry and guilt you can't leave your house. That's the plight of those who suffer from obsessive-compulsive disorder. It has no cure, but as CTV's Max Wark explains, a great deal is being done to better understand this mental illness.
Constant hand washing may be a stereotype of obsessive-compulsive disorder, but it's a true one.
Everybody we work with obsessive-compulsive disorder comes to us and says, I know this doesn't make sense.
In this controlled study, researchers at the University of Waterloo are testing worry and guilt levels through this memory exercise. It involves turning off the elements of a stove when the dials have been pulled off and the indicator light has been covered. For someone with OCD, something like this would cause anxiety to spike.
The behavior is often very protective. It's meant to keep their families from getting ill or prevent something terrible from happening.
So fearing the worst, they do it again and again.
There's a lot of research to date that's starting to indicate that the more often you repeat an action, the less confident you are that you've done that action properly.
And confidence. Knowing that things will be okay if we don't repeat something is the key difference between OCD and a routine or superstition that we all do.
You know, a common phrase like, I'm so OCD, when people talk about maybe exactness or order or having something just so, but that does really trivialize how debilitating OCD can be.
Councillor Edith Townsend says the 2% of people suffering from OCD may not be able to leave the house, which is actually counterproductive to getting better.
For a lot of people who are mentally ill who suffer with OCD, there's a tendency to isolate because they feel very alone, struggling with their mental illness.
OCD has no cure, but Townsend says the overwhelming majority of people can mitigate their symptoms through treatment.
With the right support and treatment, that recovery is really possible.
Max Wark, CTV News, Kitchener.